All right, well, welcome back to our gastrointestinal tract. Again, this is the Dr. Asharawi, and I'll be talking about the alimentary tract or the GI tract, which is the gastrointestinal tract. Now, what's happening here is that once we ingest some food and drink, it will pass through the oral cavity. Now, keep in mind that the oral cavity, that's where the mouth is being separated by the nasal cavity, which is the nose or the respiratory center, and is being separated by a hard palate, which is a bone right there. So initially, once the food will pass through the oral cavity, it will start being crunched by our teeth, which is the grinding process. Eventually, the food will be moved along from side to side by the main muscle, which is basically the tongue right here. And we have different enzymes. We have the amylase enzyme, mainly in the mucus, is being secreted. It's salivary glands, which will be the parotid gland. We have the parotid duct, and eventually this parotid duct will open up into the oral cavity. Not only that, now we have two more glands. We have the submandibular and sublingual glands. Keep in mind that we have three pairs of glands within the oral cavity. So 3 on one side and 3 on the other side, as we see through here. Okay, now once we have the food is being grinded, it would form into a bolus, which is B-O-L-U-S, that's the correct spelling for it. And basically it looks like a cannonball, like a small cannonball. And it would be descending within the alimentary tract. Not only that, it will pass through the pharynx itself. Now, this is the pharyngeal region and is being shared. This is a shared region between the respiratory tract, and that's where the trachea starts off, imaginary right there. And posterior to it will be the esophagus. So what is this esophagus? That's basically where the bolus cannonball will be passing through here by a process called peristalsis, and basically it's a unidirectional. It's a one-way direction where the food will be passing through the esophagus. And if you look over here, it looks like a muscle. So it is a muscular tube. Now this is an example of one of our smooth muscles. Now within the GI, we have the smooth muscle mainly. So in other words, it's an example of an involuntarily muscles, and the other muscles that we have will be the cardiac muscle and definitely the muscles of the rest of the body, which is the skeletal muscles. Okay, well, back again to our topic. So the food will be passing through the peristaltic movement, and basically peristaltic movement, it's a unidirectional flow, and it will kind of squeeze through along within the muscular tube, and eventually it will open up into the main connector, which will be called the sphincter. Now that sphincter is a muscle or a muscular sphincter, and the first one is called the gastroesophageal sphincter. So gastro refers to the stomach, gastric, esophageal to the esophagus, and it is a sphincter. So it is called the gastroesophageal sphincter. Not only that, now the first portion of the stomach, which is this, is called the cardia. Okay, now sometimes we would call it the cardiac sphincter, secondary to that first region. So it's still correct. So it's called the gastroesophageal sphincter or the cardiac sphincter. Okay, now whenever the bolus of food will pass through here, this will kind of send a signal for that muscular valve or sphincter to open up, allowing the facilitation of food to pass through the stomach. Once the food will pass into the stomach, now we would have a reflex saying, okay, go ahead and close or shut down. But if that sphincter didn't close or shut down, eventually that we will have some reflux. Okay, and that's why we call it reflux esophagitis, or lay language is called the heartburn. So it's one of the differential diagnoses whenever you're going to an emergency room. Let's say the 25-year-old male just finished his beautiful open buffet. He went to Hibachi or any of those places. They really have wonderful food. So what happened is that he overate. Once he overate, he would have an excess distension of his stomach because this is a muscular organ. So it's smooth, it started filling. What's happening? We have backflow of food that he could actually feel his food right there. So he ate lots and lots of sauce, lots of sodas. So what's happening? The high acidity, which is the HCl being produced by the stomach, kind of distended this sphincter right there, or the cardiac region, and eventually they open up the sphincter, and eventually he started feeling some irritation and inflammation within the lower esophageal portion. Okay, in medicine we kind of separate them into lower esophageal, upper esophageal, but that's not the case at this point. Okay, so the first region for the stomach is called the cardia. Now we have a portion that's being elevated. It's called the fundus of the stomach. And again, this will be parts of the differential diagnosis for the hiatus hernia. What is a hiatus hernia? Is basically is protrusion of portion of the fundus of the stomach back into the esophagus, or kind of sliding next to it, or the whole thing will be up within the diaphragm muscle. Now if you kind of dissect through here, let's remove the stomach, removing the liver, kind of having a better understanding up here. So this is we could track down the esophagus. So that's the esophagus, and so the esophagus is piercing through the diaphragm muscle, which is the main muscle of respiration. And again, this is the stomach right there, and that's where the connection is. So that's gastroesophageal sphincter. Okay, so let's go ahead and take a look at the stomach again. So this is the fundus of the stomach. So this is the body of the stomach. Then this is the pylorus of the stomach. And eventually we have a second sphincter right here. It's called the pyloric sphincter. Do you see the muscles? So this is a second sphincter as well. And we call it the pyloric sphincter, that would open up into the first part of the small intestine, which is the duodenum. So we refer the duodenum into first part, second part, and eventually the third part, which is posterior or inferior to the head of the pancreas. So again, we refer to it as the first part of duodenum, second part of duodenum, and third part of the duodenum. So that's the first segment of the small intestine. Now we have the small intestine. So once we have the duodenum, afterwards we have the jejunum, then we have the ileum, and eventually this ileum will open up into the large intestine. And as we see that we have a mesentery and omentum right there as well. Okay, so let's go ahead and speak briefly about the stomach as well. Now the elevation and the depression within the stomach is called the rugae, R-U-G-U-E. Rugae. And some books they would write down rugae, R-U-G-A-E. Okay, so if we look into the stomach, and let's bring the stomach over here, not only that, we will have a curvature. This is kind of a J-shaped curvature, and we will call this as a lesser curvature. Now, if we do have a lesser curvature, we must have a greater curvature. Okay, so this is the greater curvature, and it's being supplied by an arterial supply, and that's called the gastroepiploic arteries. Now we have the right gastroepiploic artery joining or encymosing along within the left gastroepiploic artery within the greater curvature of the stomach. Not only that, well, we have within the lesser curvature of the stomach, we have the right and left gastric arteries. Okay, so this is the right region, or the right gastric artery anastomosing or coming along together with the left gastric artery. Now, where are these arteries coming up from? That's a very good question. So if we look over here, And let's track it down just to make sense. All right, so that's where the gastroesophageal junction. And if we just go ahead and move the stomach to the side, then we have something called the celiac trunk. Now this is the abdominal aorta, or the descending abdominal aorta, and the first branch that's coming off is the celiac trunk. Now we will go in details over it, so the celiac trunk, but basically it will branch off towards the stomach, giving off the gastric arteries as well. Now we have a second branch that will give a branch towards the liver, and definitely we have